Hello, everybody. This is Dr. Sean Carey, and I'm with
Dr. Bill Moss.
And we are a part of the Evolving Practice podcast, and we're so happy because we have our good friend, Dr. Erin Bannink, on the episode today. Dr. Bannink is a very good friend. We've actually gone to travel the world together a bit.
Yeah.
We both went to Japan for the first time. We were taking a class out there, and we were seat buddies, sitting next to each other on
That's
like
right.
a 15-hour flight. Yeah, and then we got to Japan, and we had never been there before. We had to figure it out and how to get to the hotel and all those things. So it was a fun adventure we got to share.
It was.
And yeah, and Dr. Erin is she's a veterinary oncologist, so she has a very unique perspective on healing. She's the first veterinarian we've had on this podcast.
Mm-hmm.
So I think it'll be really fun to hear some of your story, Erin, and like just kind of how did you get here to this place where you are in terms of one, being a veterinarian, and then two, in terms of what you're doing as far as energy healing and a spiritual guide.
Yeah. Well, I'll try to keep it a little bit short, but I think you're right. Life stories are
big questions, right?
Yeah.
Big questions. I could fill the rest of the episode.
Tell me your life story. Yeah, I mean, it started when I was young. So I'm one of the unique, maybe not so unique people that came into the world with an idea of like what I wanted to be when I grew up, that I actually ended up doing it. Right. And when I was 5, and we didn't really have a lot of animals, but when I was 5 and people would ask me, what do you want to be when you grow up? This is what I would say. I'm going to be a veterinarian and I'm going to drive a red convertible. That was my answer. I don't have a red convertible yet, so I guess that part of the story is to be continued. But I'm a Capricorn, so I have a very driven personality. So I basically had that goal in mind since I was very young. So I worked hard and I got into vet school. I graduated from Michigan State University in 2002. And then I went on to do an oncology residency. So I'm a board certified veterinary oncologist. That was an adventure in and of itself. But the reason that I got into oncology is interesting because it kind of ties into how my life has evolved from there. Yeah. Because when I was in veterinary school, as you're going through veterinary school and you're in clinics, right, in rotations at the end, and you're kind of going through the different rotations, I started to realize that I didn't really want to do general practice. And so I was, exploring the different specialty options. And I did a rotation in oncology. And the reason that I chose that is because some of my experience during clinics really got me thinking about how much we grow through all of the things that happen for us, and cancer is a very interesting disease because it carries a much different impact than other diagnoses, even other terminal diagnoses, right? Yeah. And something different happens to people, at least this is my perception. A lot of times something different happens to people when they have that diagnosis, right? And we hear stories all the time about people that have, been diagnosed with cancer, and then it sort of catapults them into this transformative healing journey, right? Because you're faced with your mortality in a different way somehow. I'm not sure why that is, to be honest, than like, I have heart disease or kidney failure or something like that. And, being in the veterinary profession, what I was seeing is that there's, the human animal bond is a real thing. We talk about that. I think sometimes they get trivialized, but the human animal bond is a really interesting phenomenon. And especially the patients and the clients that I see who are coming for specialty care for their pets, they're very bonded. And there's a lot of mirroring, I guess you could say, that happens between the pets and the people. And there's a whole bunch of interesting studies that have come out in the last few years, especially showing how dogs in particular, because that's who they do these studies on, are able to perceive our emotions in a way that's very precise. And they actually can detect the difference between anxiety and fear and happiness and sadness and grief and all these different things by the way that we smell when we're having those emotions, because we secrete these chemokines, right? And so what happens, and the same thing is true in pediatric oncology, because they've done studies on like parents and children that have been diagnosed with cancer. The emotional environment of that experience gets mirrored between the children and the parents, right? So the better the parents, you know, are able to cope with the diagnoses and trust the doctor that they're working with and things like that, their ability to navigate that has a measurable impact on the child's stress levels, like emotional state, because we sort of mirror that, reflect that in each other. And the same thing really happens in dogs. And so there's some interesting dynamics like that. And so, you know, kind of getting back to the story, what I was seeing is that, I guess I would say it this way. What occurred to me is, wouldn't it be amazing if people could go through that catalytic process, that transformative process with their pet, right?
Yeah.
Rather than maybe themselves or a loved one, or like a, you know what I mean?
Yeah.
Because we learn from everything that's going around, and people just don't. I mean, it's hard when you're going through a traumatic event to have a like a perspective that's that wide. But if we could take a step back out of the emotionality of the situation, there's so much there for us in those experiences. And oncology in particular, it has a fairly high burnout rate, a professional attrition rate. It's super, super, super emotionally intense, as you can imagine, right?
Is that true across the spectrum, like from human oncology to veterinary oncology?
I would imagine. I don't actually know the statistics for the attrition rate for human oncologists, but I mean, it's intense. I mean, you're dealing with, you know, emergency room medicine is similar, right? Like, I mean, being a doctor is intense depending on the field that you're going into. There are different types of intensities with that. So, you know, I would see that what would happen a lot of time, this is maybe going to sound a little bit judgy, but this is where I was at the time. And I'm not meaning it to seem judgmental, but because that's true, you could observe, you know, as a student, I could observe people, you know, doctors that have been in oncology specialties for a long time. A lot of them either just, you know, retired early, or as a coping mechanism, get very disconnected. Do you know what I mean? Like very, because you have to. You can't be emotionally wrapped up in all of the things that people are going through. And, you know, observing that as a student, I thought, you know, what an opportunity here to, you know, if I could engage with people at that level and kind of guide them through that experience in a way that might, you know, cause some, you know, awakening in a certain way, or some aha moments, or some adjustments of their own lifestyle. And so, you know, that was inside of me already at the time, even though I was just a little baby veterinarian. And so that's really what brought me into the field of oncology, which is pretty intense. It was sort of this inherent desire that I had to help people, you know, and this question that I always had about, you know, how do we really use the experiences that happen for us to the maximum so that we can grow through those things, rather than getting sucked underneath, you know, all of the turmoil and the chaos and things that go on around that. So then in, you know, when I was in my residency, I am dealing with geriatric patients. So you know, my residency was very conventional, traditional, in the box. And so, you know, part of what I'll get to in a moment is that I think most of us that have gone through medical training experience, you know, in this environment where spirituality isn't always a welcome factor, right? And I've always been very spiritual. So the way that I got through my sciencey training and my veterinary schools, I just didn't talk about it, because you're trying to fit in, you want to get good grades, all that kind of stuff. And so I just sort of kept to myself, and could also, and I think this influenced my decision to go into oncology, right? Because as a veterinary student, I would hear, like you would have clients that would come in that would be very spiritual. And I remember one time I was actually doing my general rotating internship. I had a client that came in that had brought holy water, and she wanted us to like put it on her dog when they were in ICU, and like people made fun of her, you know what I mean? And then it made me sad. It made me really sad. But that kind of stuff happens all the time because everybody's at a different place. And so it was sort of like I had this very spiritual aspect of myself that I kind of tampered down in order to get through that part of my life. Yeah. And so when I was in my residency, I started seeing a lot of like age-related degenerative conditions. And my mom was going through acupuncture school at the time. And so I was like, I want to get some acupuncture training. So I did this is my Capricorn personality coming out. I did my acupuncture training while I was still doing my oncology residency.
Wow.
That was great.
That's a heavy load.
It was great, but it was a lot. Yes. But it really shaped a lot of things for me. And I met some amazing people that I'm still very close with and appreciate today. So that's sort of how I started breaking out of the box, which was very early on. And my mentor at the time was encouraging me, well, why don't you just try these couple of Chinese herbal formulas for cancer? And, and I'm pretty open-minded. And even I was like, you can't treat cancer with herbs. That's just silly, like it's not, that's what I thought. So I started using them to treat like chronic degenerative conditions like arthritis and, different things that were supportive things, which is how we're allowed to talk about that in the human medicine circles, right? How you support cancer patients through the treatment. So helping with appetite and nausea and all those other kinds of things. And then lo and behold, I started seeing things that I didn't expect, which made me curious. So then I went and got a graduate diploma in veterinary Chinese herbal medicine. And now my practice is 100% integrative oncology. So I practice medical oncology and Chinese medicine, essentially, in combination. So that's the core of my clinical practice, that work that I do in the world. And I meet a lot of interesting people that way. But I'm just going to keep talking because
this is great.
Roll, right? So that was going on. And then revisit what I just said about my spirituality, right? And separating that. I really, so what happened was during my residency, while I was doing all this stuff, I was extraordinarily stressed out, like in an unwell way. And I recognized that. And I had thought, I've been looking for a yoga place during vet school, and in Lansing, Michigan, there at the time were no yoga studios. So when I went to do my oncology residency,
Michigan, you guys are behind the times, huh?
Yeah. Well, and then my residency is in Michigan too, but down more towards Detroit area. And there's a yoga studio there, and I was like, I'm gonna just do some yoga because I've heard about that, and I think it might help. So that was the beginning of a long, big adventure. But it really sort of marked the beginning of this parallel journey that I was on my professional career path, and then kind of tending to my soul and spirit, which had been sorely neglected for many years. And I was slowly dying on the inside is what was happening. And so, that's when I started meditating and doing yoga very, very regularly. I got very involved with a Mahayana Tibetan Buddhist community and actually ended up teaching a lot of Buddhist philosophy and emptiness of the mind and all that kind of stuff, which I absolutely just love. I love talking about reality? Like, what is this place that we're living in, and how does the mind work, and how do our perceptions happen, and what influences all of those, and how can we take control of that process and create a life that is one that we really want to be living, right? So while I was doing my veterinary oncology work and my acupuncture training, I was this other facet of me in the evenings would go to the Buddhist study groups, and I was studying and developed a really close connection with the community here. I started a non-for-profit called the Mandala Center, where we bring teachers in. I mean, there was all kinds of stuff that was happening, which is a whole nother story.
Yeah.
But what ultimately happened was I started getting what people would say was burned out. Right? Like I was saying, like, I'm super burned out. I have compassion fatigue, all the things that people say. Now I think, I don't believe, I believe there's other causes to that. I'll just say that. But that's where I was at. And it was so bad. And I was so unhappy that I remember sitting down one day and really like having a heart to heart with myself. And I'm like, life isn't supposed to be like this. Like, I've worked so hard. I have the career that I've always wanted. From the outside, it looks like I should be happy, and I'm not. Like, I'm just not happy. And so something's wrong, and what I have to figure this out. And so I went through this internal struggle about, well, what does this mean? I'm really unhappy in my job. Does it mean that I just need to, and then I'm in the yoga community, and they're like, if you're unhappy, just quit your job. And I'm like, I don't really think it's that simple. I mean, because I'm still going to be me at the end of that decision. So,
that's good recognition. A lot of people don't see that, right?
Wherever you go, there you are. That's, And so, but it did get to the point where I was like, maybe they're right. And I really need to look at this. And so I really sat down with myself and I was like, what's going on here? And what I realized was that I had fragmented myself into so many different pieces that I was just, like I said, I was just dying on the inside because I had this very developed spiritual part of my life that fed me. I felt nourished there. I loved the people that I met in my community. I was teaching a lot. And then I had my medical career. And never the twain shall meet, because God forbid, people would judge me. Right. And we, like, all of us make decisions about fear, right? Around fear. And so I really had to, like, I just really came face to face with what's behind this. And why am I doing what I'm doing if it's not helping me? Like, what really am I afraid of? And why am I afraid of that? And would I be happier if I did life differently? And so that for me was really the turning point that got me ultimately to where I am now. Because I basically had to decide, and I think we all reach these points in our life and our own versions of it, right? Where we have to decide, it really ultimately was that I didn't accept myself. Like, if you get down to it, right? Like, there was a part of me that I was worried about being judged. And when we're in the medical profession, a lot of it is like, I don't want to lose my credibility, right? People will think I'm weird. Oh dear, that would be terrible. Well, the fact of the matter is I am weird compared to a lot of other oncologists. So, I mean, why would I try to hide who I am? Is the thing, right? And ultimately I was like, you know what, this is who I am. And that just has to be okay. And why do I care what people think? And why do I care what people are going to say about that? And so that really started a journey of self-discovery for me that, led to a lot of different things. And it was a journey, because it's one thing to say to yourself, why do I care what people think? I'm not going to care. And then to actually get to the point where you don't care. I mean, that's a hard place to get. Because we're heavily conditioned to be, to want to be accepted and to want to fit in certain ways. So that realization really is what led me to just embracing, what does it look like to be one person? Right? Instead of having all these different versions of myself running around in the world. Yeah. And so, you know, my, in yoga, they call this an act of truth. So I decided, well, my act of truth is that I'm going to put together a website because I had been kind of wanting to do this before, which I still have. It's called metapets.info. It's an integrative oncology website, veterinary one, that just says exactly that. It's like, I do integrative oncology. I'm a boarded medical veterinary oncologist. I'm trained in Chinese herbal medicine. That's my area of expertise. And I'm spiritual. And I believe that spirituality is a vital component of who we are. And, you know, living a thriving life. And we need to consider that in our discussions about health and healing and well-being. Yeah. And, you know, one of the big passions that I had at the time that I started that website also was that, you know, I wasn't the only veterinarian that I knew that was going through this burnout problem. Yeah. And so, you know, I started doing some workshops that were online, just like guiding meditations and doing things like that, but just kind of talking about it from a different perspective. And then things have just grown from there, right? Because I've spiritually, you know, grown as well in different ways and expanded. And so it's been a really fun journey. But what that really did is me stepping into that. You know, when you make a website, you're out there, right? You're like, it's out there and anybody can Google it. Right. And find it. And I was like, you know what? People are going to have opinions because they have opinions about everything. Yeah. That's what people do. And I had to decide, like, I'm just going to be okay with that. And I'm going to learn how to be strong enough to be able to be who I am and to do what I feel passionate about contributing to the world and all of that. And so then a whole bunch of things happened, but eventually, which is how I know you guys, I ended up hearing about the life activation during a time. I had a whole bunch of other weird stuff that happened in between then and when, you know, I actually got the life activation.
We'll have you on again. So you can
that's a whole different story. But I end up, you know, hearing about this thing called the life activation, being like, gosh, that just keeps getting my attention. I wonder what that is. And I really didn't have any idea. I was like, I don't know. And so I went and I sought it out and I got one thinking, you know, the worst thing that'll happen is nothing. Right at this point.
Yeah. So, it's true.
And that just opened the door. And it really was just following my inner guidance, which I had for many years been, you know, trying to develop. And my experience going down the path of initiation, which was open to me, you know, through that experience was so powerfully transformative. And like, I grew so much in such a short period of time that it, you know, when you have something like that really helps you, you want to help other people, you know? And so that's how I ended up becoming a guide and doing the guide work that I'm doing and, you know, kind of integrating all of that. And that's still like an ongoing process to see where that's ultimately going to lead. But that's the short version, the medium short version.
No, I love it.
That's a very long story, but yeah.
Well, there's a lot to the story.
Yeah.
Oh my gosh, there's so many things. Like even early on that you said that, I was like, wow, that was just really good. But I'll let you go first, Sean. Go ahead.
Well, just an off note. One thing that I'm not sure people realize about veterinarians is how difficult it is to get into vet school and how competitive it actually is. Like we had a joke in our school. I know different medical doctors have had this joke. I had many medical doctor friends. They're like, what do you call somebody who doesn't get into vet school? And the answer is doctor, because it's actually like the people will apply to vet school. They don't, if they don't make it, they'll go to regular med school. It's actually a lot easier to get into med school. Yeah, so being a veterinarian, it's so difficult to even get in, but then you have to communicate with patients or try to, you know, who don't actually speak a verbal language and their brains work completely differently. we interviewed Dr. Brian Martin, who's an ER doctor, and one of the things he shared was how important the intuition is for ER doctors.
Yeah.
Because the patients oftentimes are unconscious, they can't communicate. It's a gunshot victim or whatever. So it's like the intuition is huge with ER doctors, and I imagine that's really similar too with veterinarians.
Yeah.
And I was just thinking about, for your role as far as soothing people and the level of like difficulty involved in your work. Like you really are the perfect person for that. You're, the Capricorn and the emotional stability, and then having all the spiritual practice to be able to honor where somebody is in a way that supports their journey, but not get sucked into it. Because the last thing anybody wants is an emotional doctor. Like we can't get sucked into that role, because then all of a sudden we're down in the well with the person, like we're trapped in the well, instead of being the person on the outside who's like, here's a ladder to help you get up.
Yeah, it's true. And I will tell you that doing the work that I do in veterinary medicine is so much easier for me now after doing the work that I've done.
Oh my God. Yeah.
I mean, I did a lot of spiritual work prior to knowing that this mystery school initiation path existed. And it helped me, but it didn't help certain things.
Right.
Yeah.
And one of the things that was always a struggle for me, I've always been super, super sensitive. And, especially I was saying oncology is pretty intense, and, and I'm insanely introverted. And so it was a real stretch for me to I remember during my residency, before going into exam rooms, I'd have to I'd put my hand on the door and I'd just take a deep breath, and I'm like, okay, I'm doing this now, so that I could just really learn how to externalize myself that way, because I was so sensitive, you put all of these sort of walls around yourself, I think, to cope with the world a little bit. And people are really emotional, like they're in a highly emotionally charged situation that way. And, some people do all different kinds of things. Some people get sad and some people get angry, and for many, many years, I'm balanced enough that people get mad, I cannot react to that, but it would affect me. And so I would leave rooms and I would physically be shaking sometimes, because I was so sensitive, and that's totally gone now, And so that's why I'm saying, there are things that I can't explain
100%.
that have transformed inside of myself just by doing my work, just doing the practices and things like that. And it has affected my quality of life in so many ways that I didn't even know to ask for. And it allows me to be more present with people. I mean, I'm not perfect. I definitely have my days like we all do, right? But it's definitely much easier for me to hold that space and not be disturbed, when people are going through their process. And kind of try to be a stabilizing force for them. And, some people you can help and they really appreciate that. And some people, other things.
Well,
they don't want to be helped. I don't know, but it's made a huge difference, and it's really allowed me to be able to do my work in a much better way. So I'm so grateful for that.
Oh my gosh.
I don't know that I would still be doing it, because it was hard.
We find that so much, and we've talked about this a lot, but I feel like when you say how do I best help somebody, it's like if you're not able to even walk into that environment and handle whatever it is, it's like you're not going to be able to best help people. And when you work with higher emotional components and processes to healing, it's like I feel like the work that we do internally is so amplified, and the barrier of protection is even heightened in our own awareness to understand that it just makes it so real and kind of helps you progress in the way that you were kind of experienced. The one thing you said early that I was just found so fascinating is how you're like, if somebody can, people transform when they get that diagnosis. Right? And we've all met people that, they may not have done as much internal work, but because of that event, they experienced such transformation. And I want to know more about how you witnessed a person seeing that through their animal, and how that's helped, maybe in you working with them from a healing perspective, or just I want to hear more about that. That was one of the most fascinating observations, how people internalize this event. That's so profound.
Yeah, I mean, that it's still a work in progress, and I have a belief that there's more that is possible than what I've achieved so far.
For sure.
But I mean, the most easily accessible shift for people that I've seen for years and years and years, and one of the reasons that it's so rewarding for me to do integrative oncology is that, you know, so much I could say about this. Yeah. You know, I mean, people have a lot of self-worth issues in general. Okay. And that expresses itself in all kinds of different ways. And it's really astounding to witness how many people don't have the willpower to take care of themselves, but they'll do that for their pet.
Wow. Yeah.
You know what I mean?
Yeah.
And so it's common. And this happened even as early as in my residency, because during my residency, I was one of the few oncologists that I knew anyways, that was willing to talk to people about diet and fresh foods and different things like that, because that is sort of a weirdly controversial topic in veterinary medicine for some reason. It always has been. It's like a really good way for people to try to chop your head off. Vaccines, go for it. And then, but I would talk to people about food and, like, you know, the importance of food and all of that, and, you know, eating organic and, you know, those types of things, which seem very obvious and simple. But I had multiple people, you know, and I mean, this was 20 years ago now. Multiple people at that time come to me and say, oh my gosh, you have changed my life and my whole family's life, because after going through this experience, because this is what happens. You know, I was trained in veterinary school that if you don't tell your clients to feed their dogs and cats kibble, you will cause health problems. Okay. That was my training. And so, and it's, you know, more affordable, it's convenient. And so pets are fed highly processed food that is made from non-human grade ingredients that has more chemicals. And it's basically food sourced from food that is rejected by the FDA for human consumption. So, you know, when you transition your dog from that kind of diet to a fresh diet that's free of, or at least cleaner, as far as carcinogens and chemicals, I mean, everybody sees a difference. Like their coat quality gets better, their energy gets better. And I still, and it gets more and more, especially since I've been doing herbal therapy, people come to me and they'll say, oh my gosh, my dog is healthier now than they were before they had a cancer diagnosis. Like, you wouldn't believe it. And so I feed my children differently. I cook for myself differently. I feed my husband differently. It like changes people's idea around food. And had that not happened, I mean, maybe they would have gotten there, but it's a transformative experience that gives them, you know, I always say, information doesn't change people's belief systems. Experience does, right? So it gives them an experience of the impact of going through the effort and expense of feeding a healthier diet to a being that they love, that is totally dependent on them, that can't take care of themselves, right? And then it gets them to think, oh my gosh, you know, maybe I should think about what I'm eating and what I'm feeding my kids and stuff like that. So it really started with that. The other thing that, you know, probably a lot of veterinarians will tell you that have been in practice for any period of time, is there is a odd phenomenon that people don't talk about because we don't have a good way to explain it. In that there's a certain percentage of clients and patient pairs where the pets develop the same cancer that their humans were diagnosed with.
Wow.
Okay.
I've heard this.
And I mean, it's very interesting to me to ask the question, well, what's going on here and why is that? And I mean, I've had patients over the years, people will, and it's very traumatizing for the person, right? Because they've just probably gone through cancer treatment and all these kinds of things. And I mean, I had so many people that would say to me, oh, I had melanoma and it was metastatic. And I went through treatment and I got better. And now I'm in remission. My doctors can't believe it. And now my dog has melanoma. I can't believe that happened. Right. And it's like destroys them. And, so there's something going on in those. Like, I don't think that's coincidental. I mean, dogs don't get melanoma for the same reasons that people do as far as like environmentally and stuff like that.
Yeah.
So I always felt that there was some kind of energetic component to that, or, some non-physical phenomenon that was contributing that. Cause I always have seen the world as more than what it appears. I mean, that's always been part of my reality. So that's not a far stretch for me to, notice those kinds of things and wonder what's happening here. Yeah. And if something's happening, is there something we can do to intervene with that, and to heal that in a certain way? And, so it's, I would say that I would like to, I have some clients that are, I mean, a lot of my clients are very, very amazing. And it's a very emotionally challenging situation for most people to go through.
Yeah.
Because people feel helpless in a lot of ways. And we don't always get the outcome that we think we want, right? But that's because we don't really look at it from this perspective of like, why is this situation happening for me? Right. And if I can't, there are certain things that I can't control. And the things I can't control are all the things that are happening out there, you know? I mean, we have to do things. So like you have to go to the doctor and get medicine and have surgery and, do whatever you're going to do, like whatever kind of medical treatment you're inclined towards. You need to do something physical. And what would happen if we could work also on a spiritual level at the same time? Because I believe that, animals have a spiritual component to them as well, although they don't have the same sort of cognitive relationship with that than we do. But you can see that and you can feel that. And there's something different that happens when pets have a very strong, when there's a very particularly strong human animal bond, there's something interesting that's going on there. And, I wish that I was smart enough to find a way to sort of break through the resistances that naturally come up when you're trying to survive these emotionally traumatic experiences, right? But I do have, more and more now, it's, life is just so fun. And it's fun when you can kind of take a step back and just marvel at the weirdness of the whole thing.
Yeah.
But, people come to me now and I'll tell you a story because I think she won't mind. I won't use her name or anything, but I remember, and this is since I'm doing guide work with the Modern Mystery School and helping people like doing spiritual guide work. I had a client come in for a consultation and she of course was, very upset. Her dog had a very, very, very aggressive type of cancer. It's splenic hemangiosarcoma. I see a lot of dogs with splenic hemangiosarcoma diagnoses because our conventional treatments are just not effective, really. I mean, it would make a couple months difference in survival time. So it's a hot area of research in the conventional medicine circles because it's such a frustrating disease for us to treat as oncologists. And my survival times are much, much better using herbal medicine and dietary interventions than what's published for conventional medicine. So people that hear about that and are inclined to do alternative medicine come to see me very often. So anyway, I had this client come in with her dog and I was going through the whole regular spiel that I do. And, when I do my consultations, I basically present it like, this is what the integrative oncology consultation entails. It's modeled after what they do in human medicine. So we talk through, conventional medicine treatments, diet, herbs, supplements, acupuncture, and then mental emotional wellness. And that's sort of when I introduced them to this idea of stress and how their stress influences their pet's stress level. Yeah. And, you know, while it's not about feeling guilty, it's about just being aware of what you have control over. And, you know, are there things that you can do to help yourself navigate this very difficult situation? And if you want help, I'm here to help you. And, you know, this is what I do. Not everybody's interested in that, but I do feel that it's important. And if we're talking about whole being wellness, you know, it's common for us to talk about body, mind, and spirit in the human realm of things. And I think that, you know, all living beings have those components to them, and we're all energy at the core. And, you know, certain clients receive that, like, because they're excited. They're like, oh my gosh, I can't believe you're talking about that because you're an oncologist. And then other people aren't so interested, and that's fine. But this one particular client, I was talking about that, and she just started crying. And I was like, oh no, what did I say? You know, and she starts crying, and she's like, oh my gosh, I can't believe this is happening right now. And I said, well, what's going on? And she said, well, after her dog had surgery and had been diagnosed, and, you know, she was advised to see an oncologist, she was saying to a friend of hers that was like, she does like psychic things. She was talking to her and saying, I don't want to go because I know what they're going to tell me, and it's just going to be terrible. And, you know, and I don't know that I even want to do, you know, all those things. And her friend said, well, I mean, you can create anything that you want. And so what is it that you want? And she was saying that she wanted to, you know, I don't remember exactly how she worded it, but in essence, she had expressed that she wanted somebody that would address it from a spiritual perspective as well. And so then I'm sitting there talking about this to her in the exam room, and she's just like crying and crying and crying. And she was like, oh my gosh, this is so amazing. Like, I feel like my dog brought me to you, you know, because she was kind of going through some things herself. And so, you know, those kinds of things are really magical because we're so connected. And it's like, would it be nice for us to find the healing that we need, you know, without having to go through something difficult? Yeah. But I think that going through something difficult sometimes is the catalyst that sort of pushes us to do something different, right? It kind of breaks us out of the box that we're in. So, you know, those kinds of relationships, I think, are, you know, that's why I feel like I'm here, you know, to help people that are looking for something like that. And whether I meet them through my veterinary clients or, you know, other sorts of things, that they're people going through that journey parallel to caring for their pet, which they would have to be doing anyways if they chose to care, I think can really change the dynamic of the experience for people. And while in the end, you know, sometimes it turns out amazing and we get more time than we ever thought, which happens, you know, a lot with I mean, you always hear miracle stories, but it happens more often for me now than it did when I was just doing conventional medicine. And, you know, then we can sort of go, you know, after the pet is gone, right? Which is always going to happen, even if they don't have cancer, right? They don't live as long as we do. I mean, unless we have like a macaw or something, right? They live a very long time. But dogs and cats, so that relationship is going to be a short one. And like, you know, I always sort of wonder, well, what if they're like little angels, and how can they like help influence our life in a way that will remain, like help move us forward in certain ways after they're gone. And like what a gift that is. And I do have clients that say to me, I feel like they brought me to you. And I'm so grateful. You know, it was really hard. I'd never want to go through that again. And I've learned so much, and I'll do things differently next time because now I know different, and this is how I've grown. And that's what I want. You know, that's what I want for people, is to be able to grow through those. You know, if you're going through a challenging experience, you might as well grow.
That's great. Yeah, that's a great quote. Really good.
I'm so fascinated by that quote that you said earlier, as far as the connection between dogs having a similar cancer to what people have.
Mm-hmm.
And we can, like with physics, we're familiar with quantum entanglement and how these two particles, once they connect, whatever happens with one particle is reflected within the other, even if it's across the universe. There's this principle that's well known in physics. But it's funny when we talk about science, like if we bring it into actual like practical healthcare, it becomes this idea of like woo woo. But when it's physics, which is really the basis of all our foundational understanding, like it's very well understood and accepted. So it's so funny to me that there's this separation between these worlds.
And
I had that same struggle too, as far as being able to, like, I still go through it a bit as far as to do that merging, because it's like we do kind of live in two different worlds. And one of the things that comes up too with what you were talking about is, especially with cancer, like there is this mystery to it, and it makes people confront death, I think. And death is such a paralyzing idea for people.
There's a lot more fear around it, like diagnosis.
It's like death, and there's a mystery to it, and like the cancer itself. But like, what better person to help guide you through this process than a spiritual guide who very much is like walks the realms of spirit and has integrated that into physicality? Because like, what's death really? It's just another journey in spirit, where there's, our animals still exist and they're just in another place, is my perspective. It doesn't have to be such a separation between the physical worlds and all these other pieces that are so connected. And like, please go.
No, it's like the X factor in this process, because I think like cancer brings about that like death reality so much. That's such a spiritual experience, and we all to some degree understand the depth of that. And it's like, that's when people start to look for some deeper levels of support, right? So it's amazing that like you have that as like this integrated aspect of who you are in that situation, because it usually opens the door to like have that greater understanding, and like working with a practitioner that can see beyond the kind of the cancer in itself, and to look at the journey and the unfolding for so many people, because it can change a family, inspired, as well as, kind of create turmoil. But it really opens up many doors that are just beyond the obvious ones that you're describing. That's really, really fascinating. How you describe that. That was cool.
And another thing that I was thinking about too is that you had earlier referred to this like compassion fatigue, or that doctors have, and I think we all kind of had the same like laugh. We're exposed to it in a different way. Like the emotions we deal with aren't typically quite as intense. Sometimes people are in extreme pain, but it's the same emotional depth as what you're going to. But we also have a huge volume of people that we typically see in a day with chiropractic. So there's just like a different toll that you can have with it. But I think like something that's important for doctors especially to understand is that, like, if we're talking about oncology, these people are having some of the most intense emotions they've ever had in their entire life. And if you don't understand your own energetic boundaries and what you're like allowing in and what you're not allowing in, you're gonna get energetically run over. And like that happened to me constantly before getting introduced to the mystery school, because I just didn't have the understanding of how to manage my energy and not take on what I didn't want to take on. And I see so many practitioners just go down because they get taken out by this thing of taking on energy that's not theirs, and the accumulated effect of trying to do that over long periods of time.
Well, because I think that people that go into medicine, no matter what kind of medicine it is, tend to be very empathic, right? Which is why they have that desire to want to help people that are suffering. And I actually do some workshops for veterinarians about this particular issue of compassion fatigue, because I would love to be able to kind of spread this word more widely, because now people might not agree with my perspective, but I'll share with you what my perspective is.
Do it.
Because in veterinary medicine in general, not just in oncology, there's a huge spike in suicide rates the last 7 or 8 years. I mean, a big problem.
Oh.
To the point that foundations have been started. There's one called Not One More Vet, and different things. And so there's a movement to try to address the mental health issues and well-being issues, and they're doing it through like the measures that we would expect, right, in Western medicine, which is like psychology and counseling and things, which are all super, super important. But just going through my own personal journey, I think that for a lot of people, there's a core to that that's really not being addressed. That's a spiritual component, and that has to do with self-worth and all these sort of deep, feelings that are associated with that. And sort of wrapped up in that conversation is this label of compassion fatigue, right? Like we have compassion fatigue, like people talk about that and burnout all the time. And, now that I have moved through a lot of my own journey and, gotten some clarity around what's worked for me and why I was experiencing what I was experiencing, I personally perceive the label of compassion fatigue as sort of a misnomer and an inaccurate way of describing what's actually going on for people, because I think, don't really have a clear understanding of what compassion actually is. And what I think people are experiencing is actually empathy fatigue. Okay. Because what's happening is if you have compassion for somebody else, you are able to recognize that they're suffering. And hold this space that there's something more. Like there's a way out of the suffering.
Right.
Like I can see that you're suffering. And I have compassion for that. Whereas empathy is, I see that you're suffering and I feel you're suffering too. Right. And that's what happens. And, it's an important social skill for us to be able to be empathetic. You don't want to not have empathy. However, I think that it would help everyone in the medical profession to understand that there's a difference between empathy and compassion. And how do you understand the dynamics around empathy? Because, what literally happens is that you experience another person's pain as your own. So then I see 15 clients a day on average, let's say. So now I have taken on the pain of 15 different people with 15 different diagnoses, with 15 different personalities and psychological interaction, dynamics around that diagnosis. I have sat in a confined space with them on average for 15 to 20 minutes at least, for the consultation, sometimes 2-3 hours. I don't know how anybody really could survive that. You have to be able to be stable enough to connect. And this is what I was describing way at the beginning. I think this is the reason that people that are in this field for a long time just shut off, right? So they get very clinical, right? This is that. You're you, I'm me. I'm not going to engage. I have a wall so that I can survive and continue to function in my career without being emotionally demolished every day. And the veterinary profession is highly populated by women, right? Who tend to have a different relationship with other people's suffering and their feelings of like what's expected of them. I have to solve people's, I don't know, all the stories that we have around things. Men are different than women in that way, and so I just think there's such a big opportunity there to really discuss, how do we understand empathy versus compassion versus sympathy, right? Which is a completely different thing. And how do we get strong and balanced and healed and healthy within ourselves so that we can go into those situations, be a stable and balanced presence, right? And allow other people to have their experience, right? And hold the light that, there's something more. And, what I hope someday would be that all of the clients that walk through my door will want to explore that part of the healing process, right?
Mm-hmm.
That part of the healing process that has to do with their soul and their spirit and their energetic situation. And what we can do for that, because there's so much. I mean, we all have healings that can help support people through these different transitions.
Yeah.
And a lot of people don't know that. I mean, for me, the reason that I'm doing it is I think like, oh my gosh, if I would have known that this existed 20 years ago, my life would have been so different.
Yeah.
And I just didn't know. Like, I didn't even know to look for it.
Yeah.
I didn't even know that it existed. And so, that's why I'm just kind of like, you know what, I'm just going to tell people, and some people will want it and some people won't. But if they don't know, there's no, like, I haven't presented them the opportunity to heal if they want that. And, I think that that's, the extent of our responsibility, really. You know what I mean? Yeah. It's like, this is available to you if you want it. And if you want it, I'll help you. Yeah. And if you don't want it, I don't judge you. And that's okay. You're on your journey and you will grow in the ways that you're going to grow. But it could be a little easier, maybe.
Yeah. And just to emphasize something, like with you saying this, you talked about how fast things started progressing for you once you got exposed to the modern mystery school and path of initiation. We're talking about somebody who has, like, I forget the number, but like 10 or 15 or 20 years of experience teaching, having a deep spiritual practice and teaching others, and then getting exposed to this and having so much progression. And I know that, like, my spiritual practice before was a little different. For me, it was a lot more kind of mental. Like, I did a lot of reading and personal development, but I like read hundreds of books and did all sorts of seminars and stuff. That was a kind of a form of spirituality for me. And then I got exposed to this and I was like, oh, wow, I'm progressing in ways I'd never progressed before, despite all this time and effort and energy and money and all those things. And like, there's a gravitas to the work that we do with the lineage. It really comes from the power of lineage. These modalities, it's like Bill and Erin and myself, when we're talking about these different healings, like, we do the same modality. So it's we train and we practice and we recertify every year to make sure that we're doing the modalities correctly. And sharing these same spiritual keys and wisdom that was shared with us and caused us to have these rapid breakthroughs. So it's not like we're all just kind of winging it on our own. It's like there's really an amazing system and structure to hop on into. And when we talk about spirituality, one of you get exposed to spirituality, right? And it's like this giant world opens up. But it's also so easy to get lost in the ether with this giant world that it's just, and not really necessarily make a lot of progress. With the path of progression with the mystery school, what we're literally talking about is somebody progressing towards higher levels of their divinity. It's unique to each person what the reflection is, but to be able to embrace that higher level of their own divinity. And it's just these ancient methods to go and do that are the same no matter which practitioner you're going to, basically. Like, some of us are trained in different healings around the world, but the modality is the same. So it's just something, very cool to have such a powerful breakthrough after so many years of work and study and training.
Yeah. And I mean, sort of on that same note about just the environment of spirituality in general, because I'm speaking from my experience, because I was in the yoga community I still am in the yoga community, but that was sort of like my main spiritual family for many, many years. And I myself was doing the same thing. It's sort of like, you don't really know what's going to help you. And so you're trying out lots of different things, right? And there's so much available to us now. And a lot of it's very intellectually stimulating, right? Yeah. Especially for those of us that like to learn. We're like, oh my gosh, that's fascinating. I want to learn about this, and I want to learn about that, and I want to learn about that. Yeah. So at one level, it's like, how do you understand that it's good to learn, but then at some point you have to start doing something. Yeah. Right? Because we're conditioned to consume information, right? Yeah. Especially in the medical profession, right? Consume, right? Absolutely. Like learn. Like, the value is in the mind.
Continuing ed.
Yeah, exactly. So we're in a very consumerist sort of environment, even within the realm of spirituality, right? Yeah. And then what I see, or what I saw that lends itself to, which, you know, I mean, I was doing the same thing because I was still not getting the answers I was looking for. Right.
Yeah.
So then people dabble, like, it's like, I'll do a little bit of this and a little bit of that. And not that there's anything wrong with that, but what I see happen is that to grow, like to really make significant transformations, you end up at some point bumping up against like the hard limit of your boundaries, right? Which defines the world that you live in. Okay. This defines what I believe and what I don't believe. And when you start bumping up against that wall, things get really uncomfortable. And then what people do is they're like, "Ooh, that's kind of uncomfortable. I'm going to go over here. This looks fun."
Yeah.
You know, and then kind of you're starting over in a certain way. I mean, you've grown to get to that point, but it's like what you in order to really power through those transformative moments, right? You have to lean into the discomfort, and you have to have a method that's going to support you through the process of that hurdle. Right.
Yes.
And so you have to pick something and do it.
Yeah.
You know, and I'm not the kind of person that thinks there's only one way. Like, I just don't believe that.
Right.
But I do believe you have to have a way that works for you, that has a method, that isn't, you know, that, like, one of the things that I value about the mystery school lineage is that it's been around for a very long time, right? So it's been tried and true in a certain way, and it's designed to help us progress in a particular way to reach our highest potential, right? So you need to have a path that can guide you through the ups and downs and hurdles and obstacles and all the weird things that happen to humans while humans are going through this process of shedding the stuff that isn't really us, that we think it is, which is painful to let go of some of those things. So you need to, like, at some point commit to something. And, you know, and I was very, you know, a long time ago, like, really started going down another different path. And I did that pretty intensely, and it helped me in a lot of ways, but there were certain things that I just wasn't growing past. And it was like the energetic stuff. Do you know what I mean? That I was talking about before, you know, feeling really sensitive and, you know, all of those sorts of things. And so can I explain everything that happens? No, but I definitely think there's a power to a path that has a lineage. It has the power of the lineage behind it that's supporting us in growing and giving us the resources that we need in order to be stronger in this world that's fraught with difficulty. You know, it's fraught with challenge, it's fraught with emotions. We get very distracted and off course, and, you know, all of those sorts of things. So I mean, I'm really grateful for, you know, the life that I'm living now and all of the hard things that brought me here. You know, I'm grateful for those things too, because those have made me what I am. And like, our story is, you know, like, our stories are all unique, and it makes us powerful in the world, right? That's how we can share our experience with other people. We grow from those. And, you know, a lot of the hard things that I went through before, you know, while I never want to go through them again, you know, I understand what other people are going through, and I wouldn't have been able to do that in the same way had I not had the experience, right? So that I really can appreciate. And so now, you know, people will say things and I'm like, yeah, I know, because I know. I know. And there's a way through that that can be very beautiful, but you need to, you know, you need to choose it.
It's awesome.
So much about that too.
So good. It's a beautiful story. I mean, you have so many similarities to us, but yet provide such a powerfully different perspective to help, you know, share with people, because we all connect to healing through different means and ways, and it's amazing to see our pets. Like I have 2 dogs and a cat, and I don't know if you noticed at the beginning of this, as soon as we started, my cat walked right through. Actually, he's still right here. He's talking now. And he never makes it through the door. It's usually like pretty well shut, and he just boom right as we so he must have wanted to be in the energy of your.
Right.
Yeah. My cats were actually running around right before this started too. They're normally like quiet, but they were like all over.
I put my dogs away, and I'm like, I'm really glad I did that, because like they get really curious. So, yeah, they're like people on a path, very curious, right? So.
I love it. Erin, thank you so much for joining us. Would you be willing to share your website, any ways that people can contact you? Like you're in Detroit, you do this work, whether they want to reach out for animal care or care for their own spirituality.
Yeah. So so I have a couple of different resources I can share with people. So if people are within travel distance and they are in a situation where their pet has been diagnosed with cancer and they would like to see me for an integrative oncology consultation and help with that, I work at Oakland Veterinary Referral Services, which is in Bloomfield Hills, Michigan. The website for that is ovrs.com. And if you want to explore what I do on my various websites, I have many of them. But my integrative oncology one, veterinary oncology one, is called mettapets.info, mettapets.info. Metta means loving kindness. Okay, that's where the name came from. So I have some blogs on there and some different resources for pet parents and also for veterinarians as well. And there are some sort of like emotional support meditation, guided meditation resources and things on there. My guide and healer work with humans, which I do some of that with pets as well, is divinepowerhouse.com. And then I have an online community network where that's a monthly membership situation. And that's more, we can't do our healing work over the internet. Okay. Right. But we can have interesting conversations. Yeah. And so that is the place for us to stay connected worldwide. That website is quantumspiritualselfmastery.com. And in January, I have on there a mindfulness meditation course that walks you through. I put it together to help people. It's helpful no matter if you have a meditation practice or not, but a lot of people that I encountered, they're like, I can't meditate. I don't know how to do that. So the mindfulness practices, I have a very strong affinity for, because I think that in my experience, they've been very, very helpful to get people to be more aware of what's going on in here. So then they can adjust that, because we just live very unaware. For the most part, we live very reactively. And so it kind of walks you through the first 3 months. So you get a new guided meditation every week. And the first 3 months are for stress release. There are all different techniques for that. Then there's mental mastery, like mind, thought mastery, emotional mastery, loving kindness for self, loving kindness and compassion for other people. And then there's sort of what I call like a life mastery section of that sort of wraps up the year. So it's a 1-year-long program, and it's been self-guided, but on January 1st, I'm going to start, kind of a community journey through that course, and have some live calls and some different discussions and things with people. So I'm looking forward to that. We also have a spiritual book club every month. And then I just post interesting things on there, like videos and articles and stuff like that. So those are the spiritual and veterinary things that I do. Yeah.
Amazing. Oh, so good. Thanks again for being our guest, Erin. I mean, that was very inspiring and exciting. To get to know you on a deeper level in your story and to sharing with our listeners. So I'm sure they'll find it very valuable, and my cat finds it very valuable too.
Yes.
Yeah. Thank you so very much. And I hope you have a wonderful night. Thank you all for joining us. And we're going to have a brand new episode next week. So listen in.
All right.